I'm Eric Lipson. I'm on the HNF board, and today we're interviewing Dr. Jessie Colin, one of the founders of FSIL and the Haiti Nursing Foundation. Good morning, Dr. Colin.
Good morning, Eric. So my name is Dr. Jessie Colin, and my entry into the profession was at the baccalaureate level, a BSN, an MSN from Hunter, and my PhD from Adelphi University. So becoming involved with HNF and FSIL was easy for me to do, since I had already been very committed to service of the Haitian community. I went to a Haitian Nurses Association board meeting, since I was the immediate past president of the board, at which time I met Ruth Barnard, who was talking to us about the prospect of building a school of nursing, and it would be at the baccalaureate level, and it was going to be funded by USAID. She then said to me, you seem to know quite a bit about education. What are your credentials? And I told her that I'm doctorally prepared, and she says, a doctorally prepared Haitian nurse? You can't tell me no. Now, she hadn't asked the question yet, but I knew I couldn't say no. So I said, yes, whatever it is that I'm saying yes to. So that's how I became involved with HNF.
How long have you been teaching at Barry University?
26 years. I just retired 2 years ago. And I'm very happy that I'm retired, but it doesn't feel like I'm retired, since I'm teaching courses for FSIL in Haiti, as well as for Barry, who won't let me go yet. So, but I'm still teaching. So in preparing for the school, trying to write the curriculum, to develop a curriculum that is not something that's in the United States, but a curriculum that would be appropriate for a school in Haiti. Because our intent is not to replicate what's done outside of Haiti, but it is to use what has been done in terms of baccalaureate education, but to mold it into what would be Haiti. Because Haiti is different than the United States, particularly when it comes to community health, public health. That has to be a real significant component of any baccalaureate program. In Haiti, in the program, we've threaded for public health and community health within all the classes. And I was involved with the hiring of our dean, Dean Hilda Alcindor. Hilda and I were on the HANA, Haitian American Nurses Association board together. I was president, she was vice president. And in one of our talks, one evening, she talked about how she was becoming somewhat disillusioned and she wanted to do something more meaningful. She wasn't sure what, she wasn't sure where she would do that, what was more meaningful, but she wanted to do something else. And I didn't even realize it, but I tucked it in my head somewhere in the brain. So when we came to the point where we needed to recruit someone who would lead on site, it became so natural to me that it had to be Hilda. So although we did other interviews of a few other people, Hilda was like the person. And I called her, I could not get her. So I called another friend who also served on the HANA board with me. And she says, oh, I'll track her down. And she did. And Hilda tells me that when Nancy had called her, she was at a church, at a chapel, praying for God to give her guidance as to what she would want to do, where she's going and what her future would be like. And so when I talked to her, I said, remember you told me about wanting to do something different? I said, I think the time has come. And we want you to be the dean in Haiti. And without batting an eye or thinking much further than what I had just said to her. She said, absolutely. What I'm feeling a little bit bad about because of this pandemic, because I've left Haiti, it was early March and I haven't been back. And I had been going to Haiti just about every 4 to 6 weeks. And I feel a sense of emptiness because I am not there to give them the support that they need. Although we do things, on Zoom and you do whatever you can, but I'm missing that human touch. It's the curriculum that counts. It's how it is shaped. It's how it's delivered. That's what it is. And we need many more FSIL in Haiti because I continue to say the only baccalaureate program on the island is FSIL. We are fortunate that we've been able to create a master's program, and we have a FNP program and a midwifery program at the master's level right now, and we are going into our second cohort of RN to BSN. So now we have a second cohort of RN to BSNs. So, a little bit at a time, we're changing healthcare in Haiti, and we're changing people's lives because they are professionals. They are earning money for their services, and most of them are the first to go to college in their family.
And they stay in Haiti.
And they're staying in Haiti. And that is the beauty of our program. We created a village, a beautiful village.
Yeah, I understand during the earthquake, it was the center of recovery for Léogâne.
Absolutely, it was the only place that remained standing. And those students learned what it means to be a nurse. And I'll tell you a very short story. I had been teaching CPR at FSIL because that's one of the things I believe they should all be able to do. CPR is not something you find very much in Haiti. So anyway, I was teaching the students CPR, and one little girl said to me, well, I'm never going to put my mouth in somebody else's mouth. And I said, well, you need to be a nurse. You need to, your heart will tell you what to do when you come into that situation. And she laughed, and we laughed and left it as that. Well, after the earthquake, I went to Haiti. She came to me and she says, Dr. Colin, I just want you to know, I saved the baby, and I did put my mouth in the baby's mouth. And I saved the baby. I said, wonderful. I said, I told you your heart would talk.